Globally, about 37 million people are infected with the human immunodeficiency virus, also known as HIV. The virus, a retrovirus, was first identified in the 1980s, and at that time there was a desperate search for effective antiretroviral treatments. Unfortunately for those infected with HIV, it took some time to find those treatments. HIV infection was a death sentence throughout the 1980s and much of the 1990s. The available antiretrovirals were not very effective and they had serious adverse effects. HIV-positive individuals died horrible deaths a few years after being infected. Everything changed when new combinations of antiretroviral therapies became available in 1996. These combination therapies were very effective in lowering the concentration of the virus in blood and in controlling the disease. And since then, they have become even better. This antiretroviral therapy doesn't cure HIV-positive individuals that are still infected, but as long as they keep taking the therapy, most persons living with HIV can live an almost normal life without symptoms of HIV infection. How did we learn that the new antiretroviral therapy was effective in the first place? Because we conducted randomized trials in which HIV-positive individuals were randomized to either the old, ineffective therapies or the new combination therapies. And the results were very clear. The combination therapies, even the early ones, reduced mortality by more than half. There was no question that we had, finally, an effective way to control HIV disease through antiretroviral therapy. Shortly after this new antiretroviral therapy became widespread in Europe, North America, and other places, many investigators decided to use the newly available databases of non-experimental clinical data to answer questions about the real-world effect of antiretroviral therapy. However, to their surprise, they found that these observational investigations could not detect much benefit for the new combination therapies. The investigators were seeing in clinical practice that the therapy worked. The patients were getting better and living longer, but their observational analysis could not find an increased survival among those taking antiretroviral therapy. What was wrong with the observational studies? Confounding was certainly a possibility. Individuals with more advanced disease were more likely to receive the therapy. But the investigators were adjusting for lots of confounders, and still their effect estimates weren't close to those of randomized trials. What was going on? At the end of this lesson, you will be able to provide an explanation.